we have a healthy female and active male. With the full respect, the males today, 45 years, not active. Became reactive artificially. And this time there is nothing called blue pills or something like that. We know this. Our patients come and suffer today. 35 years old patient came and suffer from these things. He is not able to. He was good, but he is not. What's the difference? Is his genes wrong? No, he's perfect. Anything healthy in him? No. What do we eat? What did he eat? What these people were eating in the beginning? This actually inspired me with the concept of regeneration using the bioactive peptides. And this drove me to another idea. We see now 3 pictures for 3 cities. The first one is Alabama, tornado, April 28, 2011. The second one is Mumbai, April 1944, after a bomb. The third one is earthquake in Banda Aceh in Indonesia, 2004. 3 different stimuli, 3 different irritating factors. Tornado, bomb, earthquake, right? Is there any difference in the wreckage? Do you feel any difference? What will the states do to rebuild Alabama? Stones, sands, wires, steel, workers, engineers, right? What will Indonesia do to renew Banda Aceh? Stones, iron, steel, workers, engineers, the same. What will Germany do to renew, what's the very difficult name?
Pforzheim.
I don't speak German. Again, the same. Stones, sands, steel, engineers, workers. Did the cause make any difference? To regenerate the city, these cities are degenerated totally. Kidney failure, liver cell failure, Alzheimer. These cities, right? Destroyed. The same material is used. And the more we give this material with plenty hand workers, the faster we will get the results. Correct? So if the cause of destruction is the same, the process of reconstruction is the same. Whatever the cause is, we will reconstruct anyway. Look at this. Again, our cell here was affected by radiation, chemicals, thermal, bacterial, viral, genetics, or miscellaneous. Is there any pathological cause? I don't know. These are the pathological causes we learn in the medical school. There is no other pathological cause. What is the end result? Inflammation. Inflammation, right? Okay. As clinicians, tell me your prescription for the patient in each one of the cases. Nothing, antiviral, antibiotic, nothing. Right? Do we have anything else? Do we help the patient to regenerate? Pray. Just go and pray. You have some pain? Yes, take tramadol and become addicted. Is it true? We do nothing to the patient to regenerate. We do nothing to the patient to help him heal. While he came to us to heal, I saw Chinese patients, Malaysian patients, Indian patients, Filipino patients, British patients, German patients, Italian, all the nationalities want to come to heal. We do not heal them. Do we do our job? We don't do our job. We just say to him, keep it clean. Stay away from the sun. Modify your lifestyle. Stop smoking, stop drinking, stop eating, stop. It's time to die. We don't help the patient to heal. Came to me the idea Remember when I said to you in the beginning, any operation in our body, any missing factor, there will be a syndrome. Simply, suppose I have ABC hormone or peptide or enzyme needed highly to regenerate the cell. This ABC is deficient, insulin deficiency syndrome, which is diabetes. Thyroxine deficiency syndrome, which is hypothyroidism. Any deficient or increase, any disturbance in the cell, ABC is absent. ABC is done by A plus B plus C in the presence of Mn and XY. Any missing element of these five elements will give me ABC deficiency syndrome. Am I right? All right. Any objection? Any missing element, A, B, C, Mn or XY, I will have ABC deficiency syndrome. As doctors today, ABC deficiency syndrome, how do we treat it? Inject APC. Give him APC. Make him dependent on the APC. And come one big pharmaceutical company, make for us APC in vials, 20 micron for $10,000. You have deficiency APC, suffer. Enjoy it, pay. Right? We do never help the patient to regenerate his own APC. What is missing here? It's either this or that or this. Today, as scientists, not as clinicians, we are so busy to know what is missing. B or C or A, and we start to differentiate, issue classifications. APC deficiency syndrome due to C deficiency and XY deficiency. And another type due to B deficiency and Mn deficiency. Another type, and we make classification, pay money. Right? This classification of no value for the patient. This classification has no value for the patient. Because I might find out that it is C deficiency, fine. Give him C, he didn't heal. No repair. And this is what happened in one of the experiments I will show you later with one of the scientists in Russia. The exact factor missing, we don't know it 100%. But we make the patient go, make for me C levels in the blood, serum C level, serum Mn level, serum XY level. Lots of investigation and lots of money paid. At the end of the day, I am, as a clinician, not sure I will help him by this. No, sorry sir, you must make to me genetic analysis. It might be genetic. Your seventh grandfather had C deficiency syndrome. So you might have XY. God, all this the patient is suffering. All this the patient in pain. Going and coming and paying, going and coming and paying. Oh, what did it? Here, example, life in our body, Krebs cycle, steroidogenesis. Any factor missing in this Krebs cycle, we will have disturbed Krebs cycle with all its syndromes and diseases. Any factor missing here, this is our life as endocrinologists. We work on this graph. This is our area of concern. Because anything missing here, we get money. We have patients. So, my theory, simply, instead of searching for ABC, give the patient A plus B plus C plus MY plus XY plus XY plus MN, and let him do his own ABC. Plus, give him all these factors. I will help him to regenerate the cell which is producing the ABC, so that the cell fills its stores again, gain its integrity again, sensitivity and receptors again, so it will be able to generate its own ABC. And I also will show you example when the cell become dependent and healthy and don't need any help anymore. This is our approach today. Remove the cause, manage symptoms, palliative treatment. tell your last prayer. Especially when it comes to some serious diseases like kidney disease, like
cardiac failure.
For example, cardiac failure. ALS, amyotrophic lateral sclerosis. MS, multiple sclerosis. Cerebral palsy. Liver cell failure. All these we have damaged cells. What is our treatment today for kidney function? For kidney failure? Nothing. We don't have any active treatment. Neither we try to excite the regeneration of the kidney, nor we remove the cause. Our target is to remove the cause. Bronchitis, if I have bronchitis now, what you will advise me? Antibiotic. Antibiotic will kill the bacteria. I will come you after 3 days. Coughing still, but steralis putrid. No bacteria anymore, but my lung is, in fact, it's inflamed. Did you help my lung to heal? Are you sure I have the power of healing enough to heal in the proper time? Before I get hernia from the coughing? After this whole dilemma, people started to run after what's called stem cells. I worked in the stem cells in 2002. So it was still just starting. They start a first project when we heard about stem cells in life. I was in London this time. I ran to the Royal College and I volunteered to work as a technician while I was medical doctor at this time, just to learn. I wanted to know what's happening. What is there? What they are doing? What is this stem cell? They are talking about miracles. Let me see. I volunteered and I had lots of history about stem cells and the use. I will not lie to you. Yes, in the beginning you get fascinated with the concept of stem cells. You get shocked. But the more you get deep into stem cells, the less you believe in it. Especially 5 years ago, a research came from the States. 6 mice. They injected them mesenchymal stem cells. Illuminated, fluorescent. So they can track it inside their bodies where it will go. 3 of them were injected IV, 3 of them were injected IM. And they tracked it. Funny things. After 3 weeks, they slaughtered the animals and they started to search in their organs where are the fluorescence of the stem cells injected. They were expecting to find colonies of cells because actually in vitro it's enough for us to put few thousands to make the millions in 2 weeks. So they were expecting to see colonies of fluorescence in the organs. They just saw fractionated cell membranes eliminated. Fractionated. The second surprise is whatever was injected IM stayed all IM, no traces in any organ. IV, 80% of the fluorescent they found in the lungs. Because it is logic. Imagine our circulation, how it goes. I inject something IV, it will go to right edge, from right atrium, right ventricle, from right ventricle to the lung. In the lung, distribution till it becomes very small capillaries. How big is this capillary? 10 micron. How big is the cell? 10 nano. How big is the cell? 2 micron, 5 micron. This is the size of the stem cells. It cannot pass. It cannot pass the alveoli. This bud of capillaries in the alveoli act like a sieve. It trapped all the stem cells. 20% could manage to pass, and they found traces for it in the lymphatics of the lung. So through lymphatics, they could manage to find a way. Because lymphatic vessels are bigger than the blood. These blood vessels are nano size. 10 nano, 15 nano, so that it can facilitate the gas diffusion. It couldn't pass cells. So practically speaking, you inject stem cells, what happens? It goes to your lung, 80%. The 20% left scattered all over the body. Did we find any colony anywhere? We didn't. And by the way, it was autologous stem cells, which is the only type legal to be used all over the world. and it autologous means from the same person, so that doesn't mean it was not rejected. There is not supposed to be immunity reaction. We made another study. What is the fate of these which injected in the gluteus maximus? They are attacked by the autologous stem cells. Autologous stem cells are attacked by the mouse own macrophages. And this is what happened in the rest of the organs. In each organ it settles, the body deals with it as forever. They go attack. But surprisingly, and what I said now, does not make us forget the wonderful results for the patients which inject stem cells. How? If this is what I'm saying, and we have already patients with results, am I contradicting myself? Am I?
You are.
No. Logically, I'm contradicting myself, yes. But what happens is,